Good afternoon, everyone. So there's this ongoing joke. My last name is Daniel. I am not related to Dr. Juliet Daniel. So when you see me attached to McMaster, right? So we've been forced to become sisters, which I do appreciate. So again, good evening or good afternoon. So when I was first approached in terms of looking at this conference, I kept thinking to myself, what am I going to say about climate change? It's not my work. I am not a real scientist, right? And I'm hearing these brilliant young people talk about stuff I can't even remember, and energy and all of those things. But as I started looking at it more closely, and my work really looks at mental health amongst Black youth, and recognizing that there are significant impacts in terms of mental health and well-being amongst marginalized youth when we start looking at urban issues. So I started off by providing you with the sort of social determinants of health and recognizing that each of those 12 social determinants impacts the lives of Black youth. And I tried to think of, was there any one that didn't impact them in any significant way, and I could not identify any of them. And then when we layer on the issue of climate change and environmental crises, the social determinants of health now are becoming even more amplified, right? Looking at this issue specifically in an urban context. So some of you may know of the Holchansky report that was done, I think it was in 2005, where he looked at issues of poverty within the Greater Toronto area. And what he did was that he projected that there would be increasing income disparity. So what we've seen is that back in 1970, there was 66% of neighborhoods would have been considered to be middle-income neighborhoods. By 2005, we had 53% of neighborhoods that were now considered to be low-income neighborhoods. And what that essentially then means is that what we've been seeing is a decrease in income levels across the city, which now means that a higher percentage of our population is living in lower-income neighborhoods, and also that a higher percentage of racialized populations, particularly youth, are living in those neighborhoods, right? Holchansky also looked at the projections for 2025, and if you look at the changes in the color, you will see that all of those areas that are sort of that dark burgundy color, that's the spread of poverty across neighborhoods. So how is all of that connected to youth mental health? Right, so what we're seeing is increased levels of poverty and violence in those neighborhoods, increased underemployment for Black youth, continued educational challenges where we're talking about issues of racism in the school system, streaming in the school system. And what some of our research is showing as well is that Black kids are being suspended as early as JK, particularly Black males. So when you've got them being suspended that early, all of those experiences have lifetime implications. We're also seeing increasing exposure to racism. And when I say increasing exposure, but even when we talk about racism and racial trauma, we have to recognize that beyond the direct incidences of racism, what is also happening with our youth is that they're witnessing racism, particularly with the increasing access to media. So if we think about the murder of George Floyd, for example, right? And one of the points that I make is that when George Floyd was murdered, Black kids in that moment, or in those 9 minutes and 16 seconds, could see their father, their brothers, their uncles, right? But there was never any social workers sent to schools to address the racial trauma that they were witnessing. So what we're seeing is that Black kids are experiencing acute racial trauma, chronic racial trauma, vicarious racial trauma, all of them combined at the same time. And that's also then leading to increased levels of hopelessness, and as well, couple that with limited access to mental health care, we're seeing a bit of a crisis unfolding. When we now add the climate piece onto it, and even if we think of the Toronto area, where we're not directly experiencing some of the climate crises in terms of the hurricanes or the storms, but what we have been seeing is increased weather instability. So higher temperatures, when it rains, we're seeing much more flooding in the cities. And what we also know is that the groups that are experiencing poverty are the groups that are most impacted by those experiences. So even if I go back to the COVID-19 pandemic, which some can argue is also related to climate change and climate instability, one of the easy things that they told us to do is that if you contracted COVID, you simply had to isolate yourselves. Well, if you're a family of 5 or 6 and you're living in a 2-bedroom apartment, where are you isolating yourself, right? So then when they talked about the high transmission rates of COVID in poor neighborhoods, all of those things are factors that we didn't really look at in terms of the impact on youth themselves. The Canadian data has been looking more consistently at the impact of the pandemic amongst youth. But that data is not being disaggregated to specifically look at and how are Black youth being impacted by these changes. So we know that there's a destruction of the various environments that's happening in the African context, it's happening in the American context, and we're also seeing it in the Caribbean, as a number of our speakers talked about. But I think what we're forgetting is that Black kids in Toronto have families in those spaces, right? So I think of one of my students, for example, her father's in Jamaica, they just got through the hurricane, and within a week of them getting through the hurricane, he suffered a massive stroke, right? So even though she wasn't directly impacted by the hurricane, because of those familial relationships, we're also seeing increased levels of stress on the students in our spaces, as evidenced by the displacement of family members, food insecurity of family members, and also the significant traumas. And I just gave the example of the young woman and her father experiencing a stroke. What all of this is sort of lending itself to is an increased mental health challenges amongst Black youth. And there has not been a specific and intentional strategy within the context of our work to address it. So I came across this quote, which I thought was very apropos. African Canadians experience disproportionately high levels of unemployment and poverty, as well as disparities in accessing education, health, and housing. Their communities face environmental racism, whereby landfills, waste dumps, and other environmentally hazardous activities are disproportionately situated near neighborhoods of people of African descent, creating serious health concerns. So in addition to the climate crisis, we're also seeing environmental racism at play in these conversations. When we look again more broadly at the Canadian context, we're seeing that more than 1 in 4 African Canadian adolescents in BC have talked about experiencing discrimination. And what sort of that research is showing us is that when young people are reporting incidences of racism, they're also reporting lowered levels of mental health and well-being. What I'm seeing in my research as well is that there are differences between the males and the females. And it appears, and again, I'm teasing it out because it's sort of relatively new in terms of the work that I'm doing around suicidality. The females appear to be more aware of the racism than the males, right? So what that is then resulting in is that the females are typically reporting higher levels of stress, but the males are the ones who are increasingly involved in suicidal behaviors. We're also having to rethink even how we talk about mental health amongst Black males. And one of my colleagues, who has since unfortunately passed away, has used the idea of suicide by gang, wherein which the young men are not necessarily engaging in suicidal activities, but they're engaging in dangerous activities that places them in harm's way, right? And as another young man said, I'm not a punk. I'm not going out like that. In other words, he is not going to die by suicide, but he will put himself in spaces that increases the likelihood of him being killed. Right? So again, we have to begin to tease these pieces out. So when we look at the suicide rates, we know that it's increasing. And we're seeing that in the US, we're seeing it in some of the research that's happening in the Caribbean and Africa, but there's not been a consistent, actually there's not been any real research that looks at suicide in the Canadian context. And it's only last year that they started collecting race-based data. So if we look at Black youth and mental health, they are more likely to experience racism across multiple sites. Whether it's the school, whether it's employment, whether it's the neighborhoods that they're living in. And all of these pieces combined is reducing their sense of safety, it's reducing their sense of being future-oriented, and it's increasing their mental health challenges. So what we need to be looking at is how do we increase the research on Black youth and well-being? Right? There's not been a concerted strategy that looks at that. We also need to reconceptualize mental illness in Black communities. It is not something that is talked about in any significant way, and it really needs to be explored more comprehensively. We also need to examine the links between environmental and climate change and the stress levels that Black youth are exposed to, expand the conversations around Black youth mental health, and finally, it's also important for us to begin to look at developing tools that will allow for us to effectively understand or to even look at the context and the experiences of Black youth and how they're coping and dealing or even presenting mental health challenges. Thank you. Thank you.